With that, ladies and gentlemen, allow me to introduce to you our next keynote address, which is on digital workflow architecture for India's fight with COVID 19. For this session, we have with us Dr. R.S. Sharma, Chief Executive Officer, National Health Authority, Government of India. It is indeed our pleasure to have you with us today. Over to you, Dr. Sharma.
Well, good morning, friends. Dr. Jitendra Singh, Honorable Union Minister of State in the Prime Minister's Office and Minister of Science and Technology, Earth Sciences. Dr. C.M. Aswath Narayan, Honorable Deputy Chief Minister, Government of Karnataka. Esteemed and distinguished speakers and guests at the event. Uh, First of all, let me thank the ET Government Economic Times for inviting me to speak at this event, which is extremely important at this moment in time. Uh, I would like to share with you today how digital technologies have shaped India's digital landscape, and how the Digital India program of the Honorable Prime Minister launched in 2014, how it has again shaped the entire digital journey of our country in the last 7 years. So that's the broad sort of scope of my talk today before you. So one is that we established a number of digital utilities which were all scalable, which were extremely interoperable, and all built on a population scale. The other attributes of such digital artifacts were that they are, sort of frugal, very, very robust, and also, based on open standards, open APIs, and open source also. So that's the broad characteristics. The first of these, artifacts is digital identity, which India created. And now we have 1.29 billion of these identities. Almost every person in this country has got this digital identity. And this identity is quite different from the normal, identities which countries have created in the past, whether it is social security number in United States, which were created way back in the last century, 1934 to be precise, or other identities in European countries. They are all physical, paper identities in some sense. India has created an online digital identity, which is foundational in nature, which means it can be plugged into any other identity. And now we are using this identity in almost all digital transactions, be it the getting a mobile phone connection, or be it getting a ration at the fair price shops, or even marking attendance in the government offices. So this is one of the platforms which India has built, and on top of this platform, we have built a number of other products. One of them, of course, is service, the authentication service, which you can use for getting access to any formal system by proving your identity in a remote manner. The second part is the electronic KYC, which actually you can use for getting the digital identity document, which is digitally signed, and that is used for getting mobile connections or for other kinds of services. Then, of course, you have the digital signatures on demand, e-sign. You have digital locker, which again flows from the Honorable Prime Minister's Digital India program, wherein he had envisioned that every person will have a private space on public cloud, and that is the digital locker. And today we have 4 billion documents on digital locker. So there are multiple kind of products which we have built on top of Aadhaar. Then came a very major intervention in the payment space, digital payment space, which is the UPI, the Unified Payment Interface. That actually democratized the language of money transfer. And in some sense, now we have one of the largest platform for digital payments, which is actually clocking as much as 3 billion transactions, about 6 lakh crores per month, which is more than all the debit and credit cards put together, which have been there in existence since last about 40 years. So that's another very important major intervention. The other intervention is JAM, which is basically Janadan Aadhaar and Mobile, and that is actually a financial inclusion intervention, which actually was used to where you used Aadhaar to open bank accounts in a completely paperless manner, and that we opened 300 million bank accounts in a matter of as many days, 300 days. And interestingly, now our financial inclusion in terms of the opening of bank account or existence of bank account is more than 80%. 80% or more adults in India have got now a bank account. Now that works as an extremely important receptacle for poor people to receive subsidies and to receive direct benefit transfers. And as you know, we have been doing direct benefit transfer and subsidy transfer, Prime Minister's Garib Kalyan Yojana, Prime Minister's multiple schemes, which are being sort of transferring money at a billion scale to these accounts. Even a small amount of money like 50 rupees, 60 rupees, which are the LPG subsidy on a cylinder, is also being transferred through this route. So that's another very, very important major initiative which has resulted into financial inclusion and also sort of making the money available for money available for various needs of poor people. Then, of course, we have the digital infrastructure. The connectivity infrastructure has really grown in this country. Now, today we have 1.2 billion mobile connections. We have 700 million, what is called the internet connections. 600 millions, smartphones in this country. So almost everybody is now able to use these smartphones, do digital transactions of money transfer, do other kinds of digital transactions. So that's the way the vision of the Honorable Prime Minister of Digital India has actually spread the digital footprints in this country. And today our country is generating, actually we are transacting more data, transferring more data through our mobile networks than the same being done in US and China put together. That's a great achievement. So that's what we have been actually now. We have, in a way, as a country, perfected in some sense the art and science of building large scale, billion scale, population scale platforms in this country. And the latest in this series is actually, what is called COVID. You all know the vaccination program in this country was launched by the Honorable Prime Minister on 16th of January 2021. And we have put together a platform which records every vaccination event in a real-time online manner, which means it gives a single source of truth to us and is become one of the fastest growing platform, where we now have more than 400 million people on the platform in a matter of 6 months. So that's, again, no platform has grown like this. In fact, no platform has grown like Aadhaar also, where we clocked 1 billion in 5.5 years. So that's the way it is happening. Now you might ask the question, why do we require COVID? Why can't we do things in a normal manner? Why can't people go from house to house, get people vaccinated, and that's end of the story. Now you require COVID because of multiple reasons. One is that because you have 2 doses of the vaccine being given to every person, and therefore it's important that the person is given the same vaccine in both these doses. Similarly, a person has to get these 2 doses at a given interval, which is recommended by the ICMR and by the National Expert Group on Vaccination. So that's another part, and you can't keep track unless you have a digital part. It's not a small problem. Vaccinating 1.3 billion people, which is 1/6 of humanity, is not a trivial task in this country. So that is why we had to build that digital infrastructure. Another important issue is that you cannot have an asymmetry of information. You have seen in recent times when we had the second wave of COVID, where there were problems relating to availability of oxygen gas and also availability of certain critical medicines like remdesivir. And people were running helter-skelter because there was no system of, a transparent system of availability of the vaccine, the cylinders and the remdesivir. And therefore, I think it was important that if we did not have such a transparent system where you can go and register yourself, book yourself, and then get the vaccination done in an orderly manner. This is important because the scales and numbers are too humongous to really be taken care of by a manual process. So that's another reason why we had to have that process. Secondly, to ensure that everybody is able to use the system, and somebody who is not, who is digitally disabled in some sense, or who has digital on the other side of the digital divide, is also not excluded. So therefore, we had to make an inclusive system, and that inclusive system was done by ensuring that you can do it through your mobile phone. You can use your mobile phone as the main identity proxy, and you can have an OTP as an authentication mechanism, and you can create an account, and as many as four people of your family, 4 persons of your family can be registered. And even if you're not able to register, nothing, no harm is done. You can go to the vaccination center directly and get yourself vaccinated. At that point in time, your vaccination data will be uploaded. So the digital process will begin from the vaccination time rather than beginning from the registration time. So that's actually the beauty of the system, which enables hybrid modes of accessing. So you can access it through the call center of the National Health Authority 1075, or you can go to your common service centers near in the village and get yourself registered. So this is the inclusive nature of this platform is also very important to ensure that nobody is left out from the benefits of that platform. So that's another part. So we have built a platform which is inclusive, which is also, and of course we are recording the adverse events following immunization, what is called AEFI. So if there is any person who is vaccinated and within 30 minutes he develops a problem, then he can just sort of that event is recorded. Then of course we have a discovery part where you can, sitting at your home, you can figure out which vaccination centers are delivering which vaccines at what price in case it's a private vaccination center, and what are the timings and what are the seats available. So therefore, it's like a railway, booking, where you can see the seats in a particular train at particular date, and that's how you book it. So that's what you do. We also have made this platform multilingual, which means that it is available now in 12 languages, and that's what actually enables, creates more inclusivity. Then of course you can have multiple identity proof. As such, everybody in this country has got Aadhaar, but if somebody doesn't want to use Aadhaar, or somebody doesn't have Aadhaar, he can go and produce any other document which includes the photo ID card, the passports, the driving license, etc. So I think we have all those things. On an architectural basis, we have made all our platforms which are API based on standards, and this is no exception. So from the beginning itself, we had published our APIs, and then we have now allowed many third parties, and there are a large number of third parties who have integrated Owen's API into their applications, and therefore providing a much better sort of availability and accessibility of the thing. So I think it's a win-win situation for the government. We have a single source of truth. We are able to see how many people have been vaccinated, and able to drill down at the state level, at the district level, at a facility level. So that's what we are able to do. For the people's perspective, it is a very inclusive, easy to use platform where people can get slots for their vaccination and can get vaccinated. So I think we have done a very very good job out of it, I must say. And we are recording we recorded, for example, on 28th of April, we recorded a registration of 1.37 crore people. And of course, we on the 21st of June, we actually recorded as much as 9 million vaccinations in a day. So the platform has proven that it is scalable. There are no sort of glitches in the platform as people typically keep on coming. It is also evolving and scaling up, and the new things are happening. Well, now we have, our Prime Minister has directed us to make it open source, and we have made it open source, and we are training some agencies to basically become good at replicating the software. And we had a global conclave on COVID on 6th of, was it 5th of July? And large number of countries, more than 150 countries participated in that conclave. And many countries have requested us to sort of provide help in terms of, making that software available, which is now available on open source, and we have all the documentations, training materials, everything is done. So therefore, I think many countries will adopt it, and they are also free to change it the way they want to change it, and they want to customize it and modify it. So basically, a code base is available in an open source, which is amenable for changes. So that's another part. One of the latest initiatives which we are taking, and I just want to share briefly on that, talk about briefly on that, that is the National Digital Health Mission. And that program is an extremely ambitious program, which actually seeks to create a national digital platform for delivering health services using the information and communication technologies. This is basically using mobile, using video conferencing and teleconsultations. So these are all technology tools which will be used. And the whole idea is to create an interoperable network of all the providers, and whether it is a hospital, whether it's a doctor, whether it's a lab, to connect them to the patients. And that will really create the whole grid. And interestingly, it will actually help more, help people, those who are currently in remote rural areas. They are the ones who are going to be most helped by this system, because now the whole paradigm is going to change. The distances don't matter. So somebody sitting in remote rural area of, let's say, Jharkhand, will be able to connect to Tata Memorial Hospital in Bombay, and can get advice and can get the consultations done by a doctor. So that's the way, and he can get medicines delivered from the near mom and pop store. So that's the way it is going to change. The Honorable Prime Minister had launched it on 15th of August last year, and we have now replicated it in 6 union territories. Now we are ready for a national rollout as and when the proposal gets approved by the central government. We will roll it out for the whole country. We have prepared ourselves for a national rollout, and I am sure if everybody collaborates, I think we are going to see a very evolved digital platform. And because we are beginning on a clean slate in some sense, we don't have any legacy, systems. I think we can leverage the latest and the best in the technology to ensure that it becomes an extremely powerful platform. So I think that we are looking for. We are adopting an extremely consultative approach. Thus far, we have done 3 consultation papers. One relates to the creation of a health facility registry. Another relates to the creation of the other, unified health interface. How do you kind of do that? And therefore, that's the way we are proceeding. And we will ensure that privacy and security of data in all the endeavors of Government of India is sort of ensured. Many people had questioned the privacy and security aspects of Aadhaar, and there the Supreme Court, sort of resolved that issue by saying that Aadhaar is absolutely, does not create a surveillance structure, does not violate the privacy of individuals, and the data is secure, encrypted all the time. Similarly, we are doing the same thing for COVID. We will do the same thing for the National Digital Health System. So our platforms are safe, secure, robust, interoperable, ubiquitous, and of course based on open APIs and open standards. And that, I think, is the basic strength of our platforms. Our platforms are not closed platforms. Our platforms are basically based on open, non-discretionary platforms. They are, and that is the basic strength of these, because they include everybody. They are not the commercial platform. They are being used as a digital public good. And whatever we have created on a long, or on all these artifacts are essentially digital public goods. And that is the strength and uniqueness of India's digital ecosystem, which is happening under the Prime Minister's program of Digital India. Thank you very much for having me on this platform. Thank you.
Thank you, Dr. Sharma, for being with us today and sharing your perspective with us. Indeed, some valuable thoughts shared by you.